Sir, okay na po ba?
Yes, okay na. Can you now start?
Okay, good afternoon, classmates. Good afternoon, sir. So for today's discussion, or for today's topic, we are going to discuss all about health education. Now, before we proceed to the discussion, let me read the learning objectives. Next slide po. Okay, for the learning objectives, at the end of the lesson, the student should be able to first determine the importance of health education in relation to disease prevention stage. The second one, take action control to reduce the risk of diseases. And letter C, identify, assess, and implement personal wellness behaviors and individual health promotion strategies. Next slide, please. Okay. So, what is health education? Now, kapag sinabi nating health education, no, health of a person, no, especially sa mga teenagers kasi 'di ba? Tayo mga pasaway tayo so kung ano yung ipinagbabawal is yun naman yung gustong-gusto nating gawin. So, so it is the overall kumbaga health ng isang person and of course in the community which is do you call this, kumbaga ang goal ng health education is nagbibigay siya ng awareness, no? Or to increase the level of awareness, especially sa mga aspects ng health, no? Like physical health, mental health, ano pa ba, reproductive health, and of course, prevention of diseases. So, ang sabi dito that health education is defined as the principle by which individuals and groups of people learn to behave in a manner conducive to the promotion, maintenance, or restoration of health. So, kumbaga, kapag sinabi natin conducive, no, parang it is something to happen or is possible to exist, no? So, it means that health education, it help us to maintain our health, no? Paano? Paano mo naman nasabi? So kasi sabi dito, in health education, we learn to behave, no? Lalo na sa mga kinakain natin. Kaya nga nang sabi ko kanina, for example, yung doktor sinabi na bawal kang uminom or kumain ng ganito kasi may UTI ka. Pero syempre tayo, kung ano nga yung pinagbabawal, yun naman yung kinakain natin. And you know what people, every year, millions of people die, no, due to infectious disease, no, and may mga causes din like lack of health education and general public awareness, which is this situation is napaka common sa mga developing countries, no, like 'di ba alam naman natin na mataas ang rate ng infant mortality o yung pagkamatay ng baby, of course due to lack of healthcare facilities and public awareness. Kaya sabi ko nga kanina na ang goal ng health education is magbigay ng awareness sa atin. So, ano nga ba yung purpose ng health education? Sabi dito, its aim is to develop in them a sense of responsibility for health conditions for themselves as individuals, as members of families, and as communities. So basically, responsible tayo sa health natin. So kung gusto nating mabuhay ng matagal, and of course, kailangan nating ma-maintain yung health natin. So health education is included in the curriculum of most schools rather. A comprehensive health education curriculum consists of planned next next slide please. Some of these are first, the emotional health and positive self-image. Now, kapag sinabi natin emotional health, no, it is one aspect of mental health. No? Kumbaga, ito yung ability natin to cope with both positive and negative emotions. And of course, it includes our awareness of them. And ang sabi kapag if you are emotionally healthy, meaning you have a high self-esteem and low anxiety, which is very true, no? But being emotionally healthy doesn't mean na you're happy all the time, no? It means you are healthy. Kasi meaning that you are aware of your negative emotions or negative feelings, and you can cope or you can deal with them kahit na positive or negative pa yan. Kasi kung being emotionally healthy, they still feel stress, no, anger, and sadness, but they know how to manage their negative feelings. They know to how to cope with them and to deal with them. And when we say positive self-image, if you still remember our past lesson in UTS about self-image, that kapag sinabi natin self-image, this is the understanding of a person about himself or himself, which is there are three kinds. No, kung nare-remember nyo pa, ano yung three kinds na yon? Anyone? So, the first one is negative self-image. So, ano yung pangalawa? Kung naaalala nyo pa? Hello, people! Okay. So, there are three kinds of self-image, no? According sa discussion natin noon kay Sir, that the first one is the negative self-image. Now, kapag sinabi nating self-image, it delves on limitation and differences other than assets, no? And when we say overrated self-image, it means that it stresses on positive traits. And the third one is the realistic self-image. And as the name implies, it is based on real self. Now, if you have a positive self-image, it means that we can boost our physical, our mental, and social well-being. Like for example, you don't allow yourself to be manipulated, no? Meaning, nagiging aware ka sa surroundings mo, sa environment mo. Nagiging aware ka sa actions or yung pakikipag-talk ng kasama mo. Because you don't allow yourself to be manipulated. Nagiging conscious ka sa lahat ng mga nangyayari sa paligid mo. And next one is, um, you see everyone as your equal. Kumbaga, hindi ka nagja-judge ng ibang tao based on their looks, their skins, and kahit ano, no? So you see everything as your equal. And that is a positive self-image. And the second one is the appreciation, respect for, and care for the human body and its vital organs. So basically, it is our respect and of course care for the other person. So parang hindi natin sila ginajudge based on their looks, no, gaya ng sabi ko kanina, and we respect them kung ano sila, no, or kung ano yung pagkatao nila outside and inside, no. And the third one is physical fitness, top of form, and bottom of form. Ito trinay kong mag-search kung anong ibig sabihin ng top of form and bottom of form in physical fitness, pero wala akong nakitang meaning niya or specific meaning. Pero ang pagkakaintindi ko dito is when we say top of form, no, ito yung mga form of exercises which is ang na-exercise is yung upper body natin. No, like for example, chest stretch or arm stretch or head turns. So, yung mga exercises or form of exercises na ang sabi ko nga, ang na-exercise is yung upper body natin. So, the same with bottom of form or yung mga exercises or form of exercises na ang na-exercise is yung lower part of our body naman. So, kung may maidadagdag pa kayo about this physical fitness, top of form and bottom of form, please, kung may masasabi pa kayo, please speak up po. Or kung wala na, let me proceed to the number 4. So, health issues of alcohol, tobacco, drug use, and abuse. So, gaya nga ng sinabi ng mga first presenters and second presenters na malala yung epekto ng paggamit or ng pag-inom ng ganito sa health natin, no? Especially sa alcohol kasi there is a possibility na makadevelop ka ng heart disease, ng lung disease. So, syempre, makaka-apekto yun sa health natin. And of course, tobacco or yung paninigarilyo, no? Ang pinaka-common na made-develop ng disease dito is yung lung diseases, and there's a possibility na may stroke ka, no? And cancer, of course. And the drug use and abuse, ito, gaya ng sabi nila kanina na pwede kang magkaroon ng parang hallucination ka, yung parang ganun delusion, yung kumbaga hindi mo control yung body mo kapag umepekto yung side effect ng drugs. So, minsan kasi yung mga gumagamit ng drugs, no, kapag hindi nila na-control yung body nila and then nag-take yung, kumbaga hindi natin na-control yung body natin and then yung drugs ang mismong ko-control sa body mo. No, kapag pinagpatuloy mo yung paggamit ng droga. So, it can lead to physical abuse, of course, sexual abuse, and mental or emotional abuse. So, sabi ng reporters kanina na kapag emotionally abuse, it can also lead to physical abuse. Kumbaga naiinis ka, no? And then ang ko-control sa mind mo is yung droga. So kumbaga sinasabi ng droga na saktan mo na yan. Kumbaga, patayin mo na yan. So yun, it can lead to physical abuse. So first, ang nag-a-act is yung emotional or yung emotion natin. And next is the physical and of course, it can lead also to sexual abuse. Yeah. And the last but not the least, is health misconception and quackery. Now, kapag sinabi nating misconception, no, ito yung maling akala natin. No? And you know what? We have a lot of superstitious belief, no? Yung mga Pilipino, tayong mga Pilipino, na ang sabi natin na kapag matutulog kang basa yung buhok mo, and then kapag gigising mo, mabubulag ka, no? Ako hindi ako naniniwala doon as long as may proof and evidence na ipapakita. Mas maniniwala pa ako kapag sinabing kapag kagising mo, kapag natulog ka and then gigising ka, is sasakit yung ulo mo. So, mas naniniwala pa ako doon kasi manatry ko na yon. Kayo ba, may na-encounter na ba kayong kapag matutulog kang basa yung buhok is mabubulag ka? Meron na ba?
Wala.
Or wala pa?
Wala.
O, di ba? Wala
Wala.
pa. So, ayun yung isang superstitious belief ng mga Pilipino. And the next one is yung 5-second rule. Alam kong alam niyo to kasi sinabi to ni Sir noon na kapag nahulog yung pagkain natin, sasabihin natin na, wala pa namang 5 seconds, wala pa namang 3 seconds, and then kakainin natin. Pero hindi naman tayo sure kung walang germs na nakakapit doon, lalo na kapag napakadumi ng floor, no? So, tayo kasing mga Pilipino, 'di ba? Sinasayang natin yung pagkain kahit maliit pa 'yan, no? So, kahit wala pang 5 seconds or 2 seconds kinakain natin. Pero again, it concerns our health, so dapat itapon na lang natin, no? Kasi health mismo ang pinag-uusapan. And another one is the health quackery. This quackery is also called the charlatans, no? Kumbaga, when someone pretends to have knowledge or experience about something, no? Kumbaga, especially in the medical field, yung parang, it is also called the health fraud scam. Kumbaga, nagpretend silang doktor to offer medicines to cure diseases, but those medicines are not proven safe. No? So, na-issue yan noon nabalita yan noon na ang daming nagpre-pretend na mag-offer na doktor, tas mag-offer sila ng medicine, but those medicine are not proven safe. So, kumbaga, pinagpeperahan nila lang din na. So, without knowing na those medicines are pwedeng maka-apekto sa health ng mga kung sino yung pinagbebentahan nila. And, let's proceed to the next slide, please. So, in communicable disease control, health education commonly wait. Mabilis po ba ako magsalita? Hindi naman po.
Okay lang po.
Kasi parang nafe-feel ko ang bilis ko
Sakto lang. I'm so impressed the way you deliver your part, Ms. Mariano. Grabe. Na-appreciate ko. Sige, continue. Nawala siya. Ayan. Nakamute ka na. Sige.
Ay, Sorry po, ang hina po kasi ng signal. So ayun, let's
Ayun lang.
proceed bago pa po umeksena yung signal na yan. Okay. So, in communicable disease control, health education commonly includes an assessment of what is known by a population about a disease, no? An assessment of habits and attitude of people as they relate to spread the frequency of the disease. So, basically kapag sinabi nating assessment, so parang dito nila dinidiscuss or it is the process of discussing something, no? Especially sa health education sa health education. And ang sabi dito that the presentation of a specific means to remedy observed deficiencies. Health education is also an effective tool that helps improve health in developing nations. Now, kapag sinabi natin communicable disease, meaning ito yung pag-spread ng disease from one person to another. And like for example, kapag nag-uusap kayo ng best friend mo or ng kahit ano and then may sakit siya na pwede kang mahawa. Siyempre, kapag nag-uusap kayo ng harapan, pwedeng yung laway niya is tumalsik sa'yo and in that way, pwedeng matransfer sa'yo yung sakit kung may sakit yung kasama mong kinakausap mo. And another one is bitten by an insect. So, in that way, pwedeng matransfer yung disease or yung pwede kang magkaroon ng dengue. Kumbaga ganon. So, to control the communicable disease, it depends on a health environment like clean water and of course adequate sanitation. Like for example ngayon, may kinakaharap tayong pandemic which is the COVID-19 and yung government or yung ating government nag-implement sila ng mga preventive measurements. So ano to, yung gumawa sila ng protocols like social distancing, yung paggamit ng face mask, ng face shield, and pag-sanitize. Pero tayong mga Pilipino or tayong mga tao mismo ang lumalabag ton or nagiging pasaway tayo, no? So, in that way, yung mga effective measurements or preventive measurements is nakakatulong to control the spread of this virus. And ang sabi dito that health education is also an effective tool that helps improve health in developing nations, which is if you still remember again our past lesson in contemporary world, which is the digital divide, the developing and the developing nations and the developed nations, which is in developed nations, meron silang advanced technology, healthcare facilities, or sabihin natin mas advanced yung economy nila or maganda yung takbo ng economy nila. That's why mapipicture natin ngayon kung bakit importante ang health education sa mga developing countries, no? Kasi we all know naman that in developing countries, gaya ng sabi ko kanina, na mataas ang rate ng infant mortality and even the maternal mortality, which is hanggang ngayon nagsasuffer pa rin yung mga tao sa mga developing countries. And of course, infectious disease. And wala din silang access ang pag-improve ng public health and medical services and equipments sa mga developing nations. So, next slide please. So, let's proceed to what is health. In 1948, the World Health Organization defined health as a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. So, health, it is the overall health of a person, physically, mentally, and social well-being. But it doesn't mean na hindi na tayo makaka-develop ng disease kapag overall healthy natin. It depends pa rin kung hindi natin na-maintain yung proper nutrition, no? Daily exercise or whatever na ibig sabihin nito. So parang pinopoint out niya dito na the health is our support system para makapag-function tayo ng maigi sa society natin and even in our homes. No? So kasi kapag may iniinda kang sakit, magagawa mo ba yung mga daily tasks mo? Siyempre, hindi, di ba? So, dapat if you are overall healthy, and then you will be able to do your role in your society and of course sa mga bahay-bahay natin.
Okay, so nawala ulit si Princess. Internet din siguro, no? Hindi rin stable. Si Princess lang ba magsasalita? Group 3? At ang dami niya natang nasabi. Group 3, lahat ba kayo may part dito? Or si Princess lang?
Sir, lahat po kami may part.
Ayan na siya.
Sir, sorry po, umiksena po ulit ang signal. Diyos ko.
Okay lang yan. Kanina nga ako di ba?
Audible po ba?
Okay na.
Naririnig po ba ako or audible po ba? Okay, next slide po. Vincent. Okay, now let's proceed to the aspects of health, which falls into two, the physical health and the mental health. And ang sabi dito that physical fitness is good body health. And the result of regular exercise, proper diet and nutrition, and proper rest, physical recovery. Now, kapag sinabi natin physical health, it can be determined by many ways, but the major components can include regular exercise, proper diet, and nutrition, of course, proper rest and sleep rather. Because if kapag na-maintain natin to, no, pwedeng ma-improve yung health natin and of course for you to have a healthy lifestyle. No, kapag sinabing physical fitness, it is one condition of being physically healthy, no, especially sa exercise and proper nutrition, meaning that it is our ability to perform up to our potential, meaning yung pagiging flexibility natin at work or yung mga ginagawa daily tasks natin sa bahay or even in our society, no? Kasi kapag physically fit body ka, meaning it will makes us stronger. And this is also influenced by the standard of living and quality of life. And genetics plays also a major role in people's height. Now, if you still remember, nang sabi ni Sir that genetics, it deals with variation and heredity. Kumbaga, ito yung nag-e-explain kung bakit kamukha natin yung mother and father natin, or father natin, and of course, what makes us unique in our, from other people. And when it comes to height naman, humans come in a variety of height. That's why this genetics explain or plays a key role in determining whether you are short or tall. Pero ang sabi, as a general rule of thumb, no, that you can predict your height based on how tall or short your parents are. So, basically, it is based on the average height of your parents. So, pwede mong ma-inherit yung height ng mother or nung father mo. Pero may mga factors din na nagde-determine kung uh, matangkad ka or short ka, especially during adolescence and childhood. And ito yung gender. The first one is the gender. And you may notice that boys grow slower than girls, no? At first, ha, but because of the differences of puberty milestone. Pero overall, no, mas mabilis talaga tumangkad ang mga boys at ang mga boys kaysa sa girls. So, matanong ko nga, ano yung secret nyo? Ha?
Secret
Hindi,
lang.
joke lang po. Joke lang.
Tulog po.
Baka, baka kung iba-iba yung naisip ni Dan. Pero, hindi, ito curious ako. Sinearch ko kasi kung yung masturbation ba is nakaka-contribute sa height ng mga boys. And then, ang sabi is hindi daw. So, pero safe naman yung pag-masturbate. Pero, basta ma-follow mo yung safe sex process. Gaya ng sabi ni Sir noon. So, sabi dito, and another one is the hormonal consideration. Yung sa growth hormones ng isang tao. Kasi sabi that if you have a too much growth hormones, no, it can cause gigantism for children. For children. And for adults is the what we call acromegaly. Then, basta acromegaly, yung tawag dito, paglaki ng face mo and nung hands mo and even your feet, no? So, yun yung nagiging cause ng abnormalities na nangyayari sa hormones natin. And I think the tallest person in the world is si Robert Wadlow with the height of 2.72 meters. So, ang tangkad, di ba? So, parang yung height lang or yung normal height ng person is hanggang sa waist na lang. No? And for the shortest person in the world, right now, sinulat ko dito kasi hindi ko na-memorize. Itong pangalan niya is si Chandra Bahadur Danji. Taga Nepal siya with the height of 54.6 centimeters. So, yung mga case na ganun, meaning nagkakaroon ng abnormalities sa mga hormones nila. And it is said here that the study of human growth, its regulators and implications is known as xoxology. So, in other words, it is the study of all aspects of human physical growth. No? And in Greek, take note that in Greek, they define xoxology as I let grow. So, kumbaga, pag nagtanim ka ng puno is mag-grow yon. And pwede ding mangyari yan sa tao, no? Yung parang hindi tumitigil yung tawag dito, yung height ng isang tao kasi nga may abnormalities na nangyayari sa hormones nila, no? So, next slide, please. Now, let's proceed to the mental health. Next slide po. Okay. So, in mental health, it refers to an individual's emotional and psychological well-being, a state of emotional and psychological well-being in which an individual is able to use his or her cognitive and emotional capabilities, function in society, and meet the ordinary demands of everyday life. So, in other words, it affects how we think, feel, and act. And it helps us to determine how we handle stress, no, and relate to others, and of course make decision. And take note, people, that according to the World Health Organization, that there is no official definition of mental health. Pero may mga factors din na nagde-define kung ano yung ibig sabihin ng mental health, no? Like the cultural difference and the competing professional theory. Now, if you're curious, then i-search nyo na lang. Kasi if you have a good mental health, no, you feel positive about yourself, and you cope with everyday pressures. And if you experience issues dealing with everyday problems, then that is a sign of mental health problem, and it should be addressed immediately. Kasi kapag hindi natin kinaya, and then tayo lang yung sumasalo sa lahat, and then so of course, maapektuhan yung health natin. So minsan, kailangan din nating mag-open up sa relatives natin, and kahit sino, no? Or pwede ding friends natin para mabawasan yung dinadamdam natin. And did you know that sucking on your thumb helps fight depression? That's why babies suck on their thumb. So, eto isa-share ko lang kasi nung nung kinder ako hanggang grade 6, lagi kong ninunot-not itong thumb ko. Saka ko lang siya natanggal nung mag-junior na ako. Wala talaga akong planong tanggalin. No? Kasi nga, syempre, nakakahiya naman kapag habang nagkaklase ka, tapos ninunot-not mo yung thumb mo. So, ngayon ko lang din nalaman na it will fight depression pala kapag ninunot-not mo yung thumb mo. So, kapag nade-depress kayo dyan, people, no? Nut-nutin nyo lang yung thumb nyo, hindi yung iba-iba yung ninunot-not nyo, okay? Ha? I mean, pwede naman yung lollipop, di ba? Kaya talaga, hindi ko talaga makita kung anong reaction nyo. Kung walay ba or ano. Okay, sige. Next po. Next slide po. Okay, let's proceed to the determinants of health. So, the Lalonde report suggested that there are 4 general determinants of health, including first is the human biology, the second one is the environment, the lifestyle, and healthcare services. Thus, health is maintained and improved not only through the advancement and application of health science, but also through the efforts and intelligent lifestyle choices of the individual and society. So, all in all, it affects the human status and or health outcome. So, positive, pwede siyang positive or negative, especially for the most vulnerable population. Like, yung mga factors like the patient's education, yung kanilang considered when providing treatment and care, because you know what, people, that at every stage of life health can be determined by a complex interaction between social and economic factors and even physical environment and the human behavior. So nagmamatter ba ito sa discipline ng lahat? Of course, because developing a health promotion strategies that reach into communities will improve the the well-being and of course the working conditions. Now, it is said here that did you know that about 5 million children die every year due to diarrhea, which is attributed to dirty water due to pollution. Ito na-issue yan na, I mean, na balita yan noon sa Central African Republic na wala silang access sa clean water, especially sa mga urban population, which is, ang pinagkukuhanan nila ng water is sa shallow wells ba yun? Sa well, which is, yung tubig doon is napakarumi. So, kahit marumi is inom pa rin nila. So, in that case, dapat ma-address ng maaga sa kung may government ba sila doon. So, ayun, kasi kapag hindi siya na-address ng maaga, it means sino din bang magsasuffer in the end? Of course, yung mga people dun sa may urban populations, di ba? So, buti na lang yung mga Filipino, we have the ability to survive. Ia-apply ko yung lesson natin sa UTS dito sa NSTP.
Very good,
Diba?
Princess.
Thank you, sir.
Napansin
So,
ko pa
diba?
kanina ka nag-incorporate ng mga topics which I really like talaga na at least na-sense ko, okay, may natutunan siya, ina-apply niya na dito. Na-appreciate yun.
Yes,
Very
sir.
impressive. Continue.
Thank you, sir. So, yun nga, 'di ba, sabi ko that we have the ability to survive. So, kung kahit na ano yung, materials or yung nandyan is kaya nating gawan ng kahit ano, basta kaya nating gawan ng paraan. I mean, kasi 'di ba, kahit kokonti lang yung pagkain na nandyan, pwede nating i-divide or kung walang especially sa mga kabundukan na yung mga bahay-bahay sa bundok. 'Di ba wala silang minsan wala silang access sa clean water, which is gumagawa sila ng paraan para makasurvive sila. So yun naman yung advantage ng mga Filipino, nagiging resourcefulness tayo. O 'di ba? Or resourceful. Oh, okay, so next slide please, and may I call on Juvie Matias to discuss the health maintenance. And I hope guys that meron kayong natutunan sa pag-discuss.
Next slide, Vincent. maintenance. Achieving health and remaining health is an active progress. Ibig sabihin, so kapag i-maintain natin ang overall health natin, nakakatulong ito upang maging healthy ang ating katawan, and especially it helps our body in preventing diseases, at madami itong benefits sa ating katawan dahil kung maintain natin ang ating health, we are more likely feel energetic, and our body will be in good shape or better shape, at nakakatulog tayo ng maayos, and we feel really good. Effective strategies for staying healthy and improving one's health, including the following elements. So first is nutrition. Nutrition, also called nourishment or alignment, is a provision to cell and organism of the materials necessarily in the form of food to support life. In diet, the diet of the organisms refers in what it eats. So it is important because nakakatulong ito upang manatili tayong healthy, at nakakatulong ito upang ang ating healthy body weight, and it also reduces the risk of chronic diseases living in our overall health. Next slide po. Nutrients. So ano nga ba ang nutrients? Nutrients is something that provide nourishment, food or substances that necessary for our growth. So there are 7 major classes of nutrients such as carbohydrates, fats, fiber, minerals, protein, vitamins, and water. So these 7 major classes categorize helps to regulate our body function properly, at sila yung main source ng energy for the body, and it also help in building and repairing body tissues. So these nutrients classes can be categorized as either macronutrients needed in relatively large amount, or micronutrients need in smaller quantities. Next slide po. So what is micronutrients? Micronutrients means these are the nutritive components of food that our body need for energy and para ma-maintain ang ating body structure and system. The macronutrients are carbohydrates, fiber, fats, protein, and water. The micronutrients excluded fiber, water provide energy. Next po. Ay, balik mo muna. So micronutrients, these are the minerals and vitamins. So kung sa macronutrients ay need ang large amount for growth, sa micronutrients naman, ito yung mga nutrients that are needed by our body in lesser amount of growth naman and development. And this play a major role in metabolic activities of the body. And this includes the minerals and vitamins. Next po. Minerals. Dietary minerals are chemical elements required by living organisms other than 4 elements: carbon, hydrogen, nitrogen, oxygen, that are presented in common organic molecule. So gaya ng vitamins, ang minerals din ay minerals ay important because it helps our body to grow and para maging stay healthy din ang ating body. And some minerals are even used to make hormones and maintain a normal heartbeat. Next po. Macro minerals. Many elements are essential in quantity, also called bulk minerals. Some are structural, but many play a role as electrolytes. Tinawag itong bulk minerals dahil these are the minerals that typically required to ingested by human in amount of hundreds of milligram to few gram per day. So macro minerals, ito yung mga minerals na need in the diet in relatively large amount. For example, yung egg, meat, ganun, fish. Elements with recommended dietary allowance greater than 200 milligram a day are number 1, calcium. Calcium that helps body to circulate blood. Next is chlorine that helps to maintain the proper blood volume, blood pressure, helps keep amount of fluid inside and outside the cell in balance. Next is magnesium, required for processing ATP and related reaction. Next is phosphorus, required component of bones essential for energy progressing. Potassium, that very common electrolytes, especially in heart and nerve health. Sodium, a very common electrolytes but not generally found in dietary supplements. And last is sulfur for 3 essential amino acid and therefore many proteins that contribute to the health of our skin, hair, nails, liver, and pancreas. Next po. Vitamins. Vitamins are recognized as essential nutrients necessary in the diet for food health. Vitamin D is exception. It can alternatively by synthesis are in the skin and in the presence of UVB radiation. Certain vitamins compound that are recommended in diets such as carnitine and indispensable for survival and health. But these are not strictly essential because the human body have some capacity to produce of different them for other components. So, vitamins is important dahil tinutulungan niya ang ating body na mag-growth at para makapag-regulate or makapag-function ito ng maayos, and this is essential for healthy vision, skin, or our bones. At kapag mababa o kulang naman ang vitamins na natatanggap ng ating katawan, maaari tayong magkaroon ng sakit. At ang iba pang benefits ng vitamins, it also may lower the risk of lungs and gaya ng prostate cancer, and they are the powerful oxidants. So, vitamins like vitamin C boost the immune system and helps the body heal. Next is Alexandra Lugtu, who will be discuss the other principles that needed in our body health. Alex.
So, good afternoon po. Good afternoon, sir. Next po. The French paradox.
Huwag kayong kabahan ha. Feeling ko kinakabahan yung iba. Chill lang. Sige na.
Sir, kinakabahan na ako, sir. Paradox means is a self-contradictory proved to be well-founded or true. So, it has been discovered that people living in France live longer, even though they consume more saturated fats than Americans. The rate of heart disease is lower in France than in North America. A number of explanations have been suggested. Um, Dito pa sa sa bakit nga ba ang mga France daw ay mas nabubuhay ng mas matagal kahit sila yung mas nagko-consume ng fats kesa sa mga Americans. According to Professor Mahid Izzati, the lead researcher of the study, that people in countries such as South Korea and France are living longer due to diet, lifestyle, and medical technology, and reduced consumption of processed carbohydrate and other junk foods. Ethnic genetic differences allowing the body to be harmed less by fats. Regular consumption of red wine, living in mild climate, requires the body to produce less heat, allowing a slower and therefore healthier metabolic rate. So dito po sa reduced consumption of processed carbohydrate and other junk foods. Ito po yung sa mga Pilipino po kasi 'di ba mahilig po tayong kumain ng mga junk foods, gano'n yung mga matataas po yung calories, gano'n. And sila po nire-reduce po nila yung pagkain ng gano'n para sa diet. And dito po sa ethnic genetic different allowing the body to be harmed less by fat. Regular consumption of red wine. Ito pong red wine is nakakatulong din po sa health. Hindi ko lang po alam, hindi ko rin po sure kung ano yung may bibigay niyang positive sa katawan natin, pero ayon po dito sa diet nila is nagre-red wine po sila. And next slide po. Next. Exercise. Exercise is the performance of movements in order to develop or maintain physical fitness and overall health. It is often directed toward also honing athletic and ability or skill. Alam po naman siguro natin dito ang ibig sabihin ng exercise. Simpleng pagbuhat lang ng balde na may laman na tubig is exercise na yon. Exercises are generally grouped into 3 types depending on the overall effect they have on the human body. Flexibility exercises such as stretching improve the motion of muscles and joints. Aerobic exercise such as walking and running focus increasing cardiovascular endurance and muscle density. Anaerobic exercise such as weight training or sprinting increase muscle mass and strength. Physical exercise is considered important for maintaining physical fitness include number 1, healthy weight. Siguro ang healthy weight is I mean familiar po ba tayo sa obese and opo dun sa obese. Ang obese po is kinakabahan ko.
Chill lang, Alexandra. Tay-tay lang to. Okay? O, i-share niya naman sa Alexandra.
Go.
Obese yung
Chill lang.
mataba. Overweight na siya and kailangan niya ng mag-diet and building and maintaining healthy bones, muscles, and joints. promoting so so um next po, promoting sociological well-being. Ito po yung dapat etong sociological well-being is you're comfortable, happy, and the state of being comfortable, healthy, or happy. Reducing surgical risk, strengthening the immune system, and next po, hygiene top of form. Hygiene is the practice of keeping the body clean to prevent infection and illness, and the avoidance of contact with infectious agents. And hygiene practice include bathing, brushing and flossing teeth, washing hands, especially before eating, washing food before it is eaten, cleaning food preparation utensils and surface before and after preparing meals, and many others. And dagdag ko rin dito sa hygiene is yung tulad niya nitong prevent infection, like kapag makikimomol kayo or ano, always use condom, safe sex, and yun lang po. May I call on Miss Malabog to discuss the next presentation?
Yan, daming kinakabahan sa inyo. Si Princess pala nakita kong confident kanina. Okay, sige, go on.
Stress management. Prolonged psychological stress may negatively impact health, such as by weakening the immune system. Stress management is the application of methods to either reduces stress, increase tolerance to stress, which include relaxation. Techniques are physical methods used to relieve stress. Psychological methods include cognitive therapy, meditation, and positive thinking, which work by reducing response to stress. Next slide. Improving relevant skills and abilities builds confidence, which also reduces the stress reaction to situation where those skills are applicable. Sorry, sir. Reducing uncertainty by increasing knowledge and experience related to stress-causing situations has the same effect. Learning to cope with problems better, such as improving problem solving and time management skills, may also reduce stressful reaction to problems. Repeatedly facing an object of one's fears by also desensitize the fight or flight response with respect to that stimulus. Facing bullies may reduce fear or bullies. Next slide.
Hala, yun na yun? Oh my God. The next time you report, my dear students ha, wag lang natin babasahin. Kailangan natin express yung thoughts
Lang,
natin.
parang iba po kasi.
May dadagdag ka pa?
Sir, wait.
Okay, go on. Who's the next speaker? Si Joyce pa rin ba?
Yes po, sir.
We have to finish your group within the time. Hindi, dapat po 30 matapos rin kayong group 3 para next week. Wala, hindi natin na-achieve yung goal natin today na matapos lahat ng year. So, yung two groups sa Tuesday na yun, the same time sa Tuesday na yun, i-discuss ko yung last topic natin sa UTS. Yung mga tapos na, please prepare your questions. Wala, natuturuan na sila. Nababasa ko yung chat. Sige. Ang ganda ng introduction ni Princess.
Alexandra, ikaw na lang. Tulungan mo na lang si Joyce.
Pero
Uy,
sorry
tuloy
po,
niyo na.
kasi yung naano ko.
Tuloy niyo na. Tandaan niyo ha, recorded yung mga presentation niyo. Makikita niyo rito yung mga FP, yung mga... Basta lahat. Okay. O sige, na-proceed na tayo para matapos na.
So, healthcare is prevention, treatment, and management of illness and preservation of mental and physical well-being through the services offered by the medical, nursing, and allied health professions. Healthcare is the prevention. Like, ang healthcare po is sila po yung ah, yun. Sila po yung tumutulong sa'yo kapag ikaw ay hindi mentally okay, like ikaw ay depressed, stressed, or sila yung mga malalapitan mo kapag sila yung malalapitan mo kapag kailangan mo ng tulong kung hindi ka maasikaso ng friends mo or hindi ka nila matulungan kapag mentally ill ka. Work workplace wellness programs Workplace wellness programs are recognized by an increasingly large number of companies for their value in improving the health and well-being of their employees and for increasing morale, loyalty, and productivity. Public health. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private, communities, and individual. Ito naman yung the focus of public health intervention is to prevent rather than treat a disease through surveillance or cases and the promotion of health behaviors. Vaccination programs and distribution of condoms are examples of public measures. Role of science in health. Health science is the branch of science focused on health and it includes many subdisciplines. There are two approaches to health science: the study and research of the human body and health-related issues to understand how humans and animals function, and the application of the knowledge to improve health and to prevent and cure disease. Etong role of science in health, ito yung mga nagfo-focus sa mga disease, like hindi lang sa mga tao pati sa mga hayop. Sila yung mga naghe-health, nagre-research, nag-study sa mga pwedeng pang-cure sa sakit ng tao, sa sakit ng mga hayop. Infection communicable disease. An infectious disease is an clinically evident disease resulting from the presence of pa- pathogenic microbe. Pa- Hindi ko makita. Next slide ka na. Next slide ka na. Wait lang po. Infectious communicable disease. An infectious disease is clinically evident disease resulting from the presence of pathogenic microbial agents including pathogenic viruses, pathogenic bacteria, fungi, protozoa, multicellular parasites, and aberrant proteins known as prions. Ang infectious disease, ito yung mga minsan nakikita rin sa mga hayop, yung mga kuto po nila, tapos mga parasite na tinitreat din at pati po sa mga tao yung bacteria, fungi. Ang fungi po is minsan kadalasan nakukuha po natin yan kapag hindi po tayo naghuhugas ng maayos sa paa or saang parte ng katawan at napapasa po 'to sa iba kapag ito ay nagkaroon kayo ng attachment ng dalawa. So, mas mabuti po talaga na ang bago po tayo makisalamuha or makisama sa mga ibang tao, siguraduhin po natin na tayo ay hygienic like tayo po ay wala pong nakakahawang sakit. Transmission of an infectious disease may occur through one or more of the diverse pathways including physical contact with infected individual. Ito po yung sinabi ko kanina na maaari po tayong yung ito po yung maging way kung ito po yung magiging way na baka mahawaan natin yung mga nakaka-physical touch natin and magkaroon pa sila ng ating tinatawag na mga bacteria, fungi. Kaya kailangan po nating i-cure po agad kapag meron tayo nito. Next po. May I call on Cassie po? Cass?
Ay, ako po dyan. Ay, sorry.
Wala na ba? So,
Hindi,
Yes. So, yan, hindi ka maagawan. Okay. Moment man na.
sige po. Common communicable diseases. Some of the most common communicable diseases affecting many people are the following. Cholera. Cholera. Ano nga bang cholera? Cholera is bacterial disease that affects the intestinal tract. It is caused by a germ called Vibrio cholerae. Although only a few cases are recognized in the United States each year, epidemic levels of cholera have recently been reported in parts of Central and South America. Ang cholera ay isang sakit na nagdudulot ng labis na pagtatae, pagsusuka, at dehydration. Ang kondisyong ito ay dulot ng isang uri ng bakterya, sabi nga doon, na tinatawag na Vibrio cholerae. Ito maaari nating makuha sa pag-inom ng kontaminadong tubig. At maaari po na rin natin makukuha ang cholerae na ito sa pag hinugasan po natin ang mga pagkain, prutas, gulay, at bigas. Doon po natin nakukuha ang cholerae. Who gets cholerae? While cholera is a rare disease in the US, those who may be at risk include people traveling to foreign countries where outbreaks are occurring and people who consume raw or undercooked seafood from warm coastal waters subject to sewage contamination. In both instances, the risk is small. Ito rin po, who gets the color? Saan po natin nakuha ang color? Kasi po sa ibang bansa po, 'di ba, mahilig po sila sa mga undercook, sa mga kulang sa luto. Kulang po sa luto kaya po common na po sa kanila 'yon. Kaya po kasi po pag hindi po natin nailuto, dun po natin maano. Wait lang. Kaya po kasi po yung calorie po takot po sila sa init. Mamamatay po sila pag naiinitan. Kaya po dapat lutuin natin mabuti yung pagkain. How is the germ spread? The color germ is passed in the stools. It is spread by eating or drinking food or water contaminated by the fecal waste countries of an infected person. Next slide.
Joyce.
Po.
Ako yung part ng cholera. Bakit?
Ay, ikaw ba?
Hala kayo. Reduction sa may collaboration. Hindi kayo nagkasundo kung anong kaninong part. As of now, nagbigay na ako ng grade sa group 2 and sa inyo rin. We have to finish this one ha. Continue na.
So, what are the symptoms of cholera? People exposed to cholera may experience the severe diarrhea, vomiting, and dehydration, and fever is usually absent. So, hindi lang yun yung, yung mga symptoms, like, pero meron yung, pag nakakaano ka na ng dry mouth, matinding uhaw, at madami pang iba kasi ang symptoms nito. So, how do some symptoms appear? So, nag-a-appear to kapag syempre pag kumain po tayo ng pag nakaano po tayo sa mga street foods, like, hindi kasi natin alam kung marumi ba siya, ay yung bang malinis. So, pag kinain po natin siya, like, pag dumaan ng ilang oras, doon na po natin ma-feel yung disease na yun, yung disease na yun or yung yung bacteria na yun. So, next slide. So, what is the treatment for cholera? Because of the rapid dehydration that may result to severe diarrhea, replacement of fluids by mouth or by the intravenous route is critical. Antibiotic is such as tetracycline. So, ang antibiotic po kasi is, yan po ay tumutulong na maipatigil ang anumang infeksyon na nagkakos ng bacteria. At kaya din po nitong patayin yung kung ano man yung bacteria na yun sa ating katawan. So, is there a vaccine for cholera? So, a vaccine is available and is sometimes recommended for travelers to certain foreign countries where cholera is occurring. Next slide. However, offers only partial protection or 50% for a short duration or 6 to 6 months. Some physicians feel that foreign travelers almost never contract cholera and that use of the current vaccine cannot be justified. And how cholera be prevented? The single most important preventive measure is to avoid consuming undercooked foods or water in foreign countries where cholera unless they are known to be safe or have been properly treated. So, next, may I call on Mrs. Lingan to discuss the dengue. So,
Dengue fever Breakbone fever, dengue hemorrhagic fever. Dengue fever is a mosquito-borne disease caused by a virus. The disease is mainly tropical in origin, but occasionally residents or visitors from other countries may arrive in this country with dengue. Although cases originating unknown epidemic levels have recently been reported in parts of the United States or virtually the Caribbean and the Central America. So ang dengue fever ay isang infeksyon na sanhi ng isang virus na dinadala ng mga lamok at ang sakit na ito ay nakikita sa mga tropical na rehiyon sa mundo tulad ng mga bansa sa Timog Silangang Asya. Next. Who gets dengue fever? Dengue fever may occur in people of all ages who are exposed to infected mosquitoes. The disease occurs mainly in tropical Asia and the Caribbean, usually during the rainy seasons in areas with high numbers of infected mosquitoes. So, ang dengue fever ay maaaring mag-occur o mangyari sa anumang edad, and it also more likely to occur in person who have recently traveled to affected areas, and ang disease na ito ay milder sa mga bata than adults. How is dengue fever spread? Dengue fever is spread by the bite of infected Aedes mosquitoes. So ano nga ba ang Aedes mosquito? Ang Aedes mosquito or Aedes aegypti mosquito is a small dark mosquito with white layer-shaped marking and banded legs. A known vector of several viruses including yellow fever virus, dengue virus, chikungunya virus, and Zika virus. And it is originated in Africa, but they have spread through tropical and subtropical regions around the world. Also, ang species na ito can survive year-round in tropical or subtropical climates. Next. What are the symptoms of dengue fever? Dengue fever is characterized by the rapid development of a fever that may last from 5 to 7 days with intense headache, joint and muscle, and a rash. The rash develops on the feet or legs 3 to 4 days after the beginning of the fever. The hemorrhagic form of dengue fever is more severe and associated with loss of appetite, vomiting, high fever, headache, and abdominal pain. So, ang dengue fever usually starts with a high fever, matinding pananakit ng ulo, pain behind the eyes and joint bone and muscle pain, and pati na rin ang pagkakaroon ng pantal sa mga paa or binti. And ang dengue fever ay maaaring tumagal mula sa 5 hanggang 7 araw. Next po. Wait lang, back po doon. Makibalik po. Shock and circulatory failure may occur. Untreated hemorrhagic dengue results in death in up to 50% of cases. So ano nga ba yung tinatawag na dengue hemorrhagic fever? Ang dengue hemorrhagic fever ay isang mas matindi o mas malubhang anyo ng sakit at ito ay maaaring magsimula sa lagnat sa loob ng 2 to 7 days followed by vomiting, hirap sa paghinga at pananakit ng tiyan, easy bruising, pagdurugo ng ilong at possibly internal bleeding. And ang hemorrhagic fever din ay isang nakakamatay na sakit. Next. How soon do symptoms appear? Dengue fever may occur from 3 to 14 days after exposure to an end mosquito, commonly within 4 to 7 days. Does past infection with dengue virus make a person immune? Infection with one of the 4 strains of dengue virus usually produces immunity to that strains of dengue virus, but does not provide protection against the other strains. Ang immune system ng katawan ng tao ay pangunahing depensa laban sa dengue virus. Kaya when someone is infected with dengue, ang mga likas at adaptive na immune response ng katawan ay nagtutulungan upang labanan ang virus. Ngunit ang infeksyon ng dengue ay kasunod ng development of antibodies na hindi nagproprotekta sa individual. In humans, recovery from infection ng isang dengue virus ay nagbibigay or provides lifelong immunity against that particular virus, serotype. Gayunpaman, ang immunity na ito ay nagbibigay lamang ng partial or pansamantalang protection laban sa kasunod na infeksyon ng iba pang 3 serotype na virus. Next po. What is the treatment for dengue?
For a moment, Melody, do you have a virtual class to your next subject? Anong next class niyo?
Wala po, sir.
Okay, so we can finish this one na lang. Para next week yung 2 groups na lang. Okay, continue, Miss Melody. Thank you.
What is the treatment for dengue fever? There is no specific treatment available. Intravenous fluids and oxygen therapy are often used for patients who experience shock during their illness. So, walang specific treatment para sa dengue fever. Gayunpaman, ang mga may dengue fever ay dapat na magpahinga ng husto, drink plenty of fluids, and if malala ang pakiramdam, dapat magpatingin na agad sa isang healthcare provider. What can be done to prevent the spread of dengue fever? Since cases of dengue appearing in New York are imported, control measures are limited to advising travelers to affected areas to minimize exposure to infected mosquitoes. Use of mosquito netting and repellents may be helpful in minimizing exposure. So, the best way to prevent dengue fever ay dapat limitahan ang exposure sa lamok at mga lugar na pinagmulan nito and mga lugar na pinagmulan nito sa pamamagitan ng paggamit ng repellents or kulambo. Influenza. The flu is a contagious respiratory illness by influenza viruses. It can cause mild to severe illness and at times can lead to death. Some people, such as older people, young children, and people with certain health condition are at high risk for serious flu complications. The best way to prevent this illness is by getting flu vaccination. May I call on Ms. Faith to continue discuss about influenza?
Good afternoon, sir. Good afternoon, classmate. Okay. What are the symptoms of the flu? The flu usually starts suddenly and may include these symptoms: fever, usually high, headaches, extreme tiredness, dry cough, sore throat, runny or stuffy nose, muscle aches, stomach symptoms such as nausea, vomiting, and diarrhea may occur in children but are rare in adults. So, dito is yung trangkaso ay karaniwang magsisimula sa mga nabanggit ko, kaya ng mataas na lagnat na may kasamang pananakit ng ulo, malalang ubo, pananakit ng lalamunan, baradong ilong, at pananakit ng kasukasuan at pagkahilo, pagsusuka at pagtatae. Kinakabahan ako. Kadalasan dito is yung mga bata at bihira lang sa mga may edad na. Next slide, please. Kinakabahan ako, Lord.
Hoy, huwag kayong kabahan. Tayo-tayo lang to. Masanay na kayo. Kasi later on, sa majorship niyo, di ba, mag-present din kayo. At least, natitrain na kayo. So, siguro yung iba sa inyo dito, hindi nasanay siguro ng senior high school na magsulat, ay, na magsalita sa harap or mag-present. Anyway, go on, Faith.
Are some people at higher risk for complication than others from getting the flu? Some of complication caused by flu include pneumonia, dehydration, and worsening of chronic medical condition such as congestive heart failure, asthma, or diabetes. Children may get sinus problem and infection. So, dito may mga taong bihirang kapitan ng trangkaso kumpara sa iba. Gaya nga dito yung mga komplikasyon ng iba dulot ng trangkaso, kasama na dito yung mga pneumonia, dehydration, heart failure, tsaka yung asthma. Sabi nga dyan, yung mga bata, may get sinus problem and infection. How is flu spread? The flu is spread in respiratory droplets released by coughing and sneezing. It usually spread from person, though occasionally people be infected by touching something with virus on it and then touching their mouth or nose. So yung mga tao na may trangkas, ay wait lang. Syempre dito kumakalat yung flu causing of pagbabahing. For example, kapag nagbahing ka and yung isang tao ay wait lang. Mali. Um, Syempre dito kumakalat ang flu causing of pagbabahing. For example, kapag nagbahing ang isang tao, yung bahing or yung droplets hindi mo naman nakikita. So, lalanghap na yung isang tao or yung nagbahingan niya ay nagbahingan mo, for example, yung bakal or di kaya yung kahoy, tapos nahawakan niya, then hinawak niya sa mouth or anything sa part ng body niya. Example pa, kapag sa house nyo and may nagkasakit na isa, syempre, may posibilidad na mahahawaan silang lahat. Next slide, please. When and for how long is a person able to spread the flu? People with flu are contagious, able to infect others beginning one day before getting symptoms. So yung mga tao na may yung mga tao na may trangkaso na mabilis lang silang mag-spread ng sakit. The day na or the moment na nagkaroon ka na ng trangkaso, yung tao mahawaan niya agad yung katabi niya or anything na nakalanghap yung sneeze or yung pag-ubo niya. Ganun kabilis makakuha ng flu. The moment na may sakit yung isa, makakahawa agad, ganun kabilis. Adults remain contagious up to 7 days after getting sick. Sick and children can remain contagious for even longer. That means that you can give someone the flu before you know you're sick as well as when you are sick. So dito naman is before mo malaman na may trangkaso ka, hindi mo alam na may nahawaan ka na pala sa iba. Ganun kabilis mag-spread yung flu. Next po. Cold versus flu. The flu and common colds are both respiratory illnesses, but they are caused by different viruses. Because cold and flu share many symptoms, it can be difficult or even impossible to tell the difference between them based on symptoms alone. Special tests can be carried out when needed to tell if a person has the flu. These tests usually must be done within the first few days of illness. So dito naman is sa cold and flu, halos parehas lang sila. Parehas lang sila ng sintomas. So, sabi nga dito, common symptoms, pero magkaiba sila ng viruses. Iba yung flu at iba yung cold. So, kapag gusto mong ma-determine whether the flu or colds yung meron sa'yo, consult the doctor para malaman mo kung colds ba yung nasa sa'yo or flu. Parehas lang talaga sila kasi po is respiratory illness galing sa lungs mo. Next po. Jesus. What are the symptoms of the flu versus the symptoms of cold? In general, the flu is worse than common colds and symptoms such as fever, body aches, extreme tiredness, and dry cough are more common and intense. Colds tends to develop gradually while flu tends to start very suddenly. Colds are usually milder than the flu. Colds generally do not result in serious health problems such as pneumonia, bacterial infection, or hospitalization. So dito, wait lang. Dito naman is mas grave yung flu, mas mabilis mag-develop yung flu kasi sabi nga unexpected symptoms, agad-agad mo nakikita yung mga sintomas while sa cold naman mild lang siya. Di ka maproproblema sa pneumonia, diarrhea, ganon. Basta mas worse yung flu kaysa mas worse yung flu kasi nagko-cause siya ng heart failure, ganon. Ganon. And sa colds naman is mild lang. Yun lang po. May I call Trisha Lee to discuss the prevention of flu. Trisha.
So prevention of flu. So what can we do to protect ourselves against flu? The single way to best way to prevent the flu is to get a flu vaccination each fall. So there are two types of vaccines, the flu shot and nasal flu vaccine, or also called the live attenuated influenza vaccine. So the single best way, the flu shot is an inactivated vaccine containing killed virus that is given with a needle. The flu shot is approved for use in people older than 6 months, including healthy people and people with chronic medical condition. Flu shot lasts for around 6 to 8 months, is starting 2 weeks after receiving the vaccine. So inactivated influenza vaccine or the flu shot cannot give you influenza. The vaccine contains killed influenza viruses that cannot cause infection. The nasal spray flu vaccine is a vaccine sometimes called for live attenuated influenza vaccine that is made with live or weakened flu viruses that do not cause the flu. So, live attenuated influenza vaccine is approved for use in healthy people 2 years to 49 years of age who are not pregnant. Nasal spray flu vaccine weakened so that they will not cause illness. So, live virus in nasal spray flu stimulates the immune system but do not cause disease in healthy people and helps to protect against influenza vaccine. So, iniisip nyo, ay bakit may live viruses dun sa spray na yon? So, bakit hindi ba siya nag-cause ng any disease? Yung namimigay siya ng infection? So, no po. I asked my sister about this and sabi niya po yung live virus na yon ay nilagay dun sa vaccine para kapag na-take natin yon, na-receive natin, dun malalaman kung magre-react ba yung virus na yon sa atin or i-weaken niya yung what do you call this? Infection. children age 6 months, 8 years should receive 2 doses of vaccine if they have not been vaccinated previously at any time with either the flu shot or nasal spray flu vaccine. Children age 6 months to 8 years who receive only 1 dose in their 5 years of vaccination should receive 2 doses the following year. So why babies younger than 6 months can receive the flu vaccine? It's because their immune system aren't strong enough yet. Ganun din pa yung pregnant woman natin. They have a weakened immune system, heart, and lungs, and are more vulnerable to catching viruses like flu. About 2 weeks after the vaccination, antibodies develop that protects against influenza virus infection. Full vaccines will not protect against illness caused by other viruses such as common cold. Next, we have Vincent Lang. Please turn mo na.
Who should get the flu vaccine? All persons aged 6 months and older should get the flu vaccine. All persons, including school-age children who want to reduce the risk of becoming ill with influenza or transmitting influenza to others, should get the flu vaccine. Those people at greatest risk for complication of the flu and the most likely to get or spread the flu should be vaccinated with the flu vaccine as it is available. Sabi ko dito ay ang babakuna.
Vincent, are you sick? Masakit ka?
Ay, hindi po naubo lang.
Okay, make it louder. Ayun o, kuya, can't hear you, lakasan mo. Yung ba yung sinasabi ni Erickson? Go on.
You should get the flu. Dapat daw po makukuha ng bakuna para sa trangkaso ay ang mga taong na ay mga taong may edad na 6 na buwan sa pataas dapat na magpabakuna. Ang dapat i-prioritize sa flu vaccination ay ang mga children age 6 months up to their 19th birthday or persons age greater than 50 years old.
Go on, Mr. Gutierrez. Sige na, ikaw nang last, diba? Oh, tapusin mo na.
Women will be woman who is pregnant during the influenza season, and children who have chronic lung and heart, kidney, liver, or blood or metabolic disorders, including diabetes, should get vaccinated, should get the flu vaccine mm, para maiwasan ang pagkakaroon ng malubhang komplikasyon ng influenza virus.
Are you done? Ah, okay na tayo? Sige, natapusin mo na. I still have another class for major shift.
Who should not be vaccinated? There are some people who should not be vaccinated.
Vincent?
Other group mates, pwedeng tulungan niyo na lang siya or kayo na mag-present? Kasi parang
Vincent? Sa who should not be vaccinated, please pakibalik mo doon. Who should not be vaccinated. So there are some people who should not be vaccinated. They include people who have a severe allergy to chicken eggs. So why? Bakit ang daming pwede, di ba? Pero bakit sa chicken eggs? It's because some of flu vaccines are made up of using eggs. So you may be at risk of an allergic reaction to the vaccine's injection if you have a severe allergy to eggs. People who have a severe reaction to influenza vaccination in the past. So, severe reaction, anaphylaxis is very dangerous kasi it can be fatal. So, kung may reaction ka na before and it's severe, so please wag ka nang mag-take. So, be careful kapag mag-take ka ng vaccine o ask mo muna yung mga pharmacists, general practitioners, consult doctors muna for vaccines with low eggs or egg-free vaccine before taking it. People who develop Guillain-Barré. Guillain-Barré is a rare autoimmune disorder in which person's own immune system damages the nerves, causing muscle weakness and sometimes paralysis. So GBS can cause symptoms that last for a few weeks to several years. Some who develop Guillain-Barré are fully recovered, but some also took the symptoms permanently. So children less than 6 months of age, sabi ko nga po kanina, yung babies younger than 6 months, yung immune system nila hindi pa strong. So, hindi pa niya kaya yung vaccine. And people who are sick with fever, these people can get vaccinated once their symptoms lessen. People with a mild illness can usually get a vaccine. So, if you are sick, wag ka munang magpa-vaccine. So, hintayin mo munang malesen yon before ka magpa-vaccine. So, ngayong pandemic, nagpapa-vaccine tayo at kapag may naramdaman kang symptoms like na hindi pwede doon, like may severe reaction ka to like the vaccine na, tapos may allergy ka, may asthma ka or anything like that, please sabihin mo, hindi lang dapat sorry. Huwag kang magsinungaling like sa ngayon, like sabihin mo lahat kasi ikaw lang din naman yung magsasuffer at the end. So, and that's it.
Vincent?
Can antiviral medication prevent the flu? For antiviral drugs, amantadine, rimantadine, oseltamivir, sanamivir are licensed by the U.S. Food and Drug Administration (FDA) for treatment and prevention of the flu. Antiviral drugs are not a substitute for influenza vaccinations. All of these drugs are available only by prescription, and they are different in terms of who can take them and how they are given. Dosage are based on their age, medical condition, and side effects. In addition, some influenza virus types or subtypes may be resistant to certain antiviral drugs. So a doctor can decide whether you should take an antiviral drug or which one you should use.
So let me help Mr. Vincent lang. So for this four Zanamivir, amantadine, and zanamivir helps to prevent the flu or para hindi kayo makadevelop ng pwede kang tawag dito, pwede mong ma-prevent na makuha yung flu or ma-transfer sa yung flu by injecting this or to take this medicine. So like for example, sabi nga kanina, like yung papavaccine natin, like the Pfizer dito sa virus na kinakaharap natin ngayon. So in that case, there is a possibility or hindi naman tayo sure kung hindi na tayo mahahawaan kapag na-shot na tayo or I mean nagpa-vaccine na tayo. So there is a possibility na pa rin. So kailangan pa din nating maging tawag dito maging what do you call this? Kailangan pa din nating maging aware, no, or pangalagaan nating sarili natin kasi sabi nga 'di ba, health education or health napaka-importante sa atin, which is kapag gusto mong, sabi ko nga kanina, na kapag gusto mong humaba yung life mo, and then you have to take care of yourself, take care of your health. So through this medication, you will be able to prevent those flu. So I hope, sorry for the problems na nangyari and even the technical problems. So I hope that you have learned about our topic. May natutunan kayo sa pagdi-discuss namin about this health education. And again, sorry for the problems and even the technical problems. I hope you understand. Thank you po for listening.